Hello, I'm Therese Kopitko and I'm a dental hygienist. I've been teaching in the dental hygiene program for over 25 years. Today we're going to learn about the assembly of XCP instruments that are used in taking dental radiographs intraorally using film. XCP instruments, or the XCP term, refers to extension cone paralleling, which is the type of technique that is used intraorally for these radiographs. And as you can see on the photograph, that in order to properly expose these films so that we can ensure quality radiographs, we need to use film holders, or a holding device, which allows the film to be in the mouth, or as we see in the picture, held in the mouth. And it also has various parts, a locator ring and indicator rod, which assist in lining up our X-ray machine. So if we take a look here a second, these are the various parts here of the XCP instruments. We have an instrument for the posterior area. We have another one for the anterior region, and then the last one for interproximal or bite wing radiographs. So let's look at these different parts so that we can distinguish between them and then begin to assemble them. Let's look at the first one. The first one, these are called, by the way, indicator rods. This particular indicator rod is used for posterior film holding devices and exposures. It has a couple distinct characteristics. It has two right angle bends as well as the two prongs on the end. All of the angles are in the same plane. And so again, that's the posterior indicator rod. The anterior indicator rod is quite similar, but it does have one distinguishing feature. In addition to having the two right angle bends, it also has a twist at the end. Can you see that? Here's two right angle bends, and then it twists. And that differs from the posterior, which again is, all of the angles are in the same plane. So this is the anterior, and this one is the posterior. Now, when we take a look at the interproximal indicator rod, it's actually the simplest of all. To me, it looks just like the letter F. So these are the three indicator rods that are used in exposing intraoral radiographs using the XCP film holder. Next, let's talk about the bite blocks. This is the posterior bite block. The film is actually placed into the bite block. It looks like this. The posterior bite block holds the film in a horizontal position. So if we focus on the back of the bite block, you can see that the film would be held in a horizontal position. A little bit different than the anterior bite block, which resembles the posterior. However, again, if you focus on the back of it, you can see that it would hold the film in a vertical position. That would be used for anterior. So here we have the posterior and anterior bite blocks. The interproximal or bite wing bite blocks are a couple of them. They look different, completely different than the other two. One of them is used to hold the film in a horizontal position. That's this one. The other one is used to hold the film in a vertical position. And depending on the preference of the dental practice in which you're employed, the dentist's wishes, or whether the patient has periodontal issues, one may select a vertical placement or horizontal placement, again, depending on the patient and the dentist's preferences. So these are the two bite blocks that are used for interproximal or bite wings. The last part of the film holding devices include the locator rings, and in reality there are only two of them. There's the anterior ring, which is also used for interproximal bite wings. If you look at it carefully and hold it by the stem, you can see that that ring is perfectly centered, perfectly balanced on that stem. And that differs from the posterior ring, which when it is held by the stem is actually off-center slightly. Can you see where it's kind of on a tilt compared to the anterior ring? And again, as I mentioned, the one that's slightly off-center is used for posteriors, and the one that is centered is used both for anterior film holders as well as for interproximal film holders. So let's put these together right now. Taking our posterior indicator rod, which again, as I mentioned before, has the two right angle bends, and our posterior bite block, which holds the film in a horizontal position, we obviously place the two prongs in the two holes on the bite block. Can you see that? And we go ahead and put it together, and there we go. So we have most of it put together. Looks like this. All we need to do is add our locator ring, and as I mentioned before, the locator ring that we use is the one that's slightly off-center. To ensure that it's put on accurately, we slide it onto the rod's end and look through the center of the ring. When you look through the center, you'll see that the back of the bite block is centered in the ring. It should be right in the center. A common error that often occurs is putting that locator ring on upside down. Consequently, if you look through the center of the ring where actually our X-ray beam would be focused, you can see that the top of the film or part of the bite block would not be exposed at all, and so therefore our film would only be partially exposed. That would be a major error. So again, to ensure that the device is put together properly, look through that center. Make sure the back of the backing is centered in the ring. Let's now look at the anterior bite block and film holder device. As I mentioned before, select your indicator rod. That's the one that's slightly more complex. It has the two right angle bends and the extra little twist. Select the appropriate bite block, which again looks like this, but it would hold the film in a vertical position. It too has two holes and the two prongs, and this is important how you actually put it together, because many mistakes are made in this assembly. I like to think of the proper way of putting it together, the finished product, to look like a chair, where we have the back, the seat, and the dangling feet. Back, seat, dangling feet, kind of like a chair. Frequently, the error that occurs is the assembly will be incorrect, so that we have the back, the seat, but if you take a look at the feet, well, they look like they're propped up a little bit. That's not the way we normally sit on a chair. So again, to avoid a major mistake, what we want to do is assemble it so that we have a complete chair with a back, seat, and your feet dangling. As I mentioned before, we will use the other ring. That's the one that is centered or balanced on the stem. Same idea, you slide the ring right onto the rod, and to check if you have it accurately assembled, you look right through the center of the ring, and the back of the bite block should be centered as you look like right through there. Alright, the final instrument that we use, again, as I mentioned, is the interproximal instrument. This is the one that looks, the indicator rod that looks like an F, very simple. And again, we have the two unusual looking bite blocks. For simplicity here, let's just select one of them. Let's say the horizontal bite block. Pretty easy to put together. We've got the two holes, we've got the two prongs. Basically just put them together. And to be sure it's put together properly, I like to think of it as having the tail of an airplane on a string that can simply fly right on through the air. Because if you imagine yourself, you know, like one would hold a balloon, holding with a string the tail of the airplane so it would fly, we will be able to have it assembled properly. Otherwise, it's very easy to put it on backwards, and you certainly won't be able to expose quality radiographs that way. So again, just a little simple reminder, think of it as flying your airplane, your jet airplane tail right through the sky. Flip it to the side, take your locator ring, again remember this is the same one we used for the anterior, which is balanced on the stem, and we place it right on the indicator rod. Same idea, when you look through the ring, the bite block should be right in the very center. So there you have it. We have our 3 bite blocks. We have our posterior bite block. No, I'm sorry, posterior film holder. We have our anterior film holder. And again, the significant difference between these are the anterior has the back, seat, and feet, whereas the posterior it has the back and seat, but missing the feet dangling down. So there we have the anterior, posterior, and anterior. And then we also have our interproximal instrument, which again can fly through the air, or obviously when it's assembled, look like this. So it's simple. Now let's try it.